Banner Health is a health system out in the southwest and western United States. We are spread across 6 states and have 28 facilities altogether, 22 of which are 340B. We feel that our mission to our patients through 340B is to help provide care to those indigent patients and in those rural communities that we have to help expand the services that we can give them. For these patients that we see, our 340B programs are able to help us provide care across this range of healthcare services, often extending the care that we are able to provide or even just keeping the doors open in some of those critical access areas. We would see in our outpatient areas, mainly in the ED, might include patients that have a scorpion sting. Being in the Southwest, this is something that we see frequently in some of our DISH or larger facilities. These patients that we normally have come into the ED are going to be our elderly or our very young that are more susceptible to this type of injury. Antiscorp is an antivenom that can help minimize or reduce the complications that are seen in these patients. Antiscorp is also a very expensive medication, and for those facilities where Antiscorp is used, the 340B program allows us to offset that cost that the facility would have to take on when the underinsured or uninsured patients end up receiving it. Another use of our 340B savings is seen in our retail pharmacies. Covered entities contribute some of their savings on a monthly basis to support a medication take-back program where the community can bring any unwanted or unneeded medications in, therefore preventing the potential for abuse or reducing the potential for abuse or diversion of those medications. If 340B were scaled back or stopped, Banner Health would be impacted severely. At our larger facilities, we would not be able to offer the programs that we currently do. Our outpatient areas would suffer and some of those programs would have to be stopped. In our smaller critical access facilities, a reduction in the 340B savings or in the program in general would result in communities losing healthcare services that we're able to provide. The savings that the program produces helps keep those facilities open and operating, and the patients would end up losing their source of healthcare in those areas.